We receive patients from the ER who are suspected to have COVID.
Rachel Hendricks is a nurse at IU Health Arnett. She primarily works in the progressive care unit, which is now specifically a floor where COVID-19 positive and suspected positive patients are treated.
And even if they test positive, they may go home in a couple days, but there's always the risk that some patients will be unstable. So as PCU nurses, we're used to taking care of unstable patients.
She's taking care of the patients while also taking care of herself. Hendricks, like many medical workers, has a family at home. She says the worry of possibly spreading the virus to her loved ones is something she thinks about.
My family's aware that I do have maybe a risk of bringing it home, but they understand that I'm a nurse and that's what they want me to do. They want me to be out there serving.
On the same floor taking care of COVID-19 patients are nurses' right-hand helpers, the patient care assistants.
They deal with the medication and the doctors, and then once they leave the room, that's kind of my time to be, hey, are you comfortable? Do you need anything? Can I help you get cleaned up this morning?
Elizabeth Dabbs is a PCA on the floor for COVID-19 patients. The floor has more than 20 rooms. Several of those Dabbs is responsible for.
Unfortunately, I have had the pleasure of having an entire hall, and that can be up to 12 patients per day per shift.
Dabbs says it's an emotionally tasking job for every healthcare worker during this time.
We have to be a caretaker, a friend, sometimes family will sit with people, but it's hard on every person part of the care team, really, because what can you do?
It's the support of the community that Dabbs says encourages them to know they are not alone.
Just keep throwing high fives at us. We've had people stand with posters in our parking lot. We had someone dressed as a chicken. But it's awesome that they're so supportive of us.
In Tippecanoe County, Marvin Bills, News 18.